Hello, this is Dr. Bob with another Get to Know video for you. And today, we're going to talk about medications, prescription medications, and over-the-counter medications. And I know right now, in the United States alone, there are 45 million children under 21 years old that are on asthma medication. That's how many prescriptions have been written for asthma alone. 25 million medications for ADHD alone. The average Medicare patient is taking 5 different medications every day. Medications have bad effects. The difference between a bad effect and a side effect, it's all media driven. Medications work by modifying physiology in your body. You say, Dr. Bob, what does that mean? Let's say that you have digestive distress, acid indigestion, and they make the decision to put you on something called a proton pump inhibitor. I know that it's a big word, but it stops. It's an acid stopper. It stops acid from being produced in your digestive system. Do you know in the long run that's very unhealthy? What I have found from my experience is that most people after they're about 40 years old actually have a reduced amount of acid being produced in their stomach, and their food in their stomach literally starts to putrefy, causing the extra acid. So by taking a proton pump inhibitor, you're altering your normal physiology in your body. I've also read research that it could be one of the leading causes of Alzheimer's. How can that be? Because your body's not absorbing protein and other very important minerals. Do you take aspirin every day? You know, aspirin is a blood thinner that tricks your body. But very important for you to realize, if you have a fracture and you start taking aspirin, do you know that aspirin use can help slow down fracture healing? How about cholesterol? Cholesterol medication is probably one of the most common medications that's been prescribed in the United States. Do you know that people die every day with heart attacks with normal cholesterol? You see, the most common cholesterol medication is a statin drug. It works by altering physiology in the liver. Your liver is the place where the statin drug tricks your body and taking cholesterol out of the circulation that helps make hormones in your body, including pain hormones. See, one of the side effects, one of the bad effects of a statin drug is liver disease. You could also have Parkinson-type shakes, glaucoma, optic stroke. These are just some of the common body signals from the side effect of statin drugs. It's very frightening. Do you take blood pressure medication? You know, there are 2 common blood pressure medications that can alter physiology in your body. One is called a calcium channel blocker. That alters calcium absorption in the body. And if you're taking this medication, or you have parents or grandparents that are taking this medication, you actually could get up from a sitting to a stand position and literally have a stroke and pass out. What I have found in our practice, vitamin D will help individuals that have high blood pressure. Another blood pressure medication is called a beta blocker. A beta blocker is a type of medication that alters the normal physiology from a gland in your body called the adrenal gland that makes something called epinephrine or norepinephrine that speeds your heart up. If you're presenting with your healthcare provider and you have a high blood pressure issue, I would suggest you might want to make some appropriate and necessary lifestyle modifications first before you attempt to take especially a blood pressure medication over time. Always talk to your prescribing healthcare provider. Do you have a child that takes ADHD meds? Do you know that ADHD medications can stunt growth and cause other reactions in the body? Do you know that most ADHD medications, especially the Schedule II ones, have the same effect as cocaine? They really impact the body in a very negative way. What about medications for sinus problems that end up stopping antihistamines in your body? What we have found from our experience that one of the leading causes of chronic sinus problems happens to be dairy products and even peanut butter. But probably the most significant medication that I see that impacts people in a negative way are medications that are used for the thyroid gland. Ladies, if you're listening to me right now and you're watching this and saying, what is he talking about? Well, their thyroid medications themselves, not including Armour Thyroid, which is a combination of T4 and T3, and those of you that are on thyroid medication may not know, but thyroid medication is T4, that's Tom4, which needs to be converted to T3. What I found from my experience, ladies who are menopausal, you can actually, one of the side effects or the bad effects of thyroid medication is osteoporosis. You want to know what the other effect is? Iron deficient anemia. I just had a lady that came into our practice that's had anemia for 10 years and nobody could figure it out why, and one of the side effects of her medication caused anemia. I would always encourage you to talk to your prescribing healthcare provider to find out what you can do in lieu of the medications that you're taking. Do you know that it's estimated up to 20 million Americans are depressed? And they wake up every day and they're tired and they're sluggish and they're on a medication. One of the leading causes of depression is poor fat metabolism and low thyroid function. If you're depressed right now, you do not go off of your antidepressants. I would encourage you to have a thyroid profile done, which would include a TSH, a T3, and a T4. Have someone that's skilled analyze those results and support you properly. That will make all the difference in the world. Now, because you're on medication, you just don't run off and stop the medication. It's very serious. You have to make appropriate and necessary lifestyle changes. You need to get to the cause of why you would have been placed on the blood pressure medication, the diabetes medication, or the antidepressants in the first place. You may need to exercise more, eat, change your diet, maybe alter some of your relationships. But if you make progressive steps to improve your overall lifestyle, I can tell you over time, I know you can get off those medications. Follow a few of these tips. I promise you, you'll be glad you did.